Hi, my name is Arlene Dayrit, and I'm with California Youth Services, and today I'm going to be talking about anxiety. Some goals that we have for today are looking at what does anxiety look like, so talking a little bit about signs and symptoms of anxiety, as well as discussing and debunking some myths about anxiety. We're going to also look at introducing some healthy coping skills to manage and deal with your anxiety, and also further treatment and support options. So, anxiety in a nutshell. So today we're going to be looking at some signs and symptoms, emotional and physical, about anxiety. I think it's also important to recognize that anxiety manifests in a different way for everybody. So emotional symptoms could look the same or also different, depending on the person and their reaction and also the severity of their anxiety. So some emotional symptoms that are common, but there are also many other symptoms, like I mentioned, are feelings of apprehension or dread, as well as feeling tense or jumpy or maybe more on edge than normal. Also, trouble concentrating, irritability, or also anticipating the worst. So, when I say anticipating the worst, it just means that you're anticipating that everything you're going to experience is going to be the absolute worst experience. Some physical symptoms also include pounding heart, sweating, upset stomach or dizziness, shortness in breath, muscle tension, headaches, fatigue, or also even insomnia. So it's also important to differentiate that some of these could also just be from physical exertion. So something like exercise, some type of running, something that's physically exhausting could also manifest in similar symptoms. But if you're experiencing these physical symptoms in reaction to something more like a trigger or a stressful event, that could also be a symptom of anxiety. So, what is a panic attack? Panic attacks are typically in response to an anxiety provoking situation. So typically they're sudden without really any warning, usually in response to a trigger. So when I say trigger, I mean something that affects you very directly. So perhaps you've been exposed to a specific trauma. Now, if you encounter that specific trauma again and you experience a very sudden, overwhelming surge of panic, that could be also a panic attack. Typically, panic attacks are pretty severe, could last up to 30 minutes, although that's not always the case. And they do peak around 10 minutes. So, physically speaking, it also feels like it could be something like a heart attack. Other symptoms as well of a panic attack are feeling like you're going to lose control or pass out, trouble breathing or hyperventilating, and also shaking and trembling. Other types of anxiety disorders are things like generalized anxiety disorder, anxiety attack or panic disorder, obsessive compulsive disorder, phobias or social anxiety, and post traumatic stress disorder or PTSD. So, now we're going to talk a little bit about myths and facts about anxiety. So, the first myth we're going to talk about is anxiety isn't real. So, the fact is that anxiety, like I mentioned, is in response to a trigger or a stressful event. This could be something as like health issues, it could be something like somebody in your family passed away. It could be really any type of stressful event. It could even be something that's positive. So maybe you're going to go up on stage and perform, but that's also anxiety provoking. Another myth about anxiety is that people with anxiety should avoid stressful situations in order to avoid feeling anxious. This is nearly impossible. On any given day, there could be at least one stressful event that you would come into contact with. To try to avoid that could also be more anxiety provoking. Another fact about anxiety is that it is a common experience for many Americans. In fact, according to the National Institute of Mental Health, about 18% of American adults experience an anxiety disorder on any given year. In another study in the International Journal of Methods in Psychiatric Research, 12.1% of adults experience a specific phobia. So, much like I mentioned earlier, specific anxiety disorders such as generalized anxiety disorder, panic disorder, obsessive compulsive disorder, and all others are experienced by 12.1% of adults in this study. Just goes to show that anxiety is a common experience for many adults. Another myth about anxiety is that therapy takes forever and it will not help me. So, Contrary to popular belief, there are specific therapies that help, such as cognitive behavioral therapy or CBT. So many of these anxiety specific therapies actually are targeted and useful for helping manage and deal with anxiety. Another fact about anxiety is that using substances is a common method among people with anxiety disorders, but it's not an effective treatment. Basically, using substances to cope with anxiety is a short-term solution with short-term results. Even though it's common, you're not really getting at the root issue, which is where therapy or other methods can come into play. Another fact also is that you can become dependent on substances if you don't have any healthy coping skills. So maybe you feel that you or somebody you know fall under this category of anxiety. Now what? I'm going to introduce you to a few coping skills, as well as our next series we'll talk a little bit about other further skills that you can use to help manage and deal with your anxiety. So the first we're going to talk about is regular self-care. It is so important to talk about this because I think that regular self-care, making sure you get appropriate rest, and also making sure that you get exercise is essential to being able to feel like you're living your healthiest and your best. Connecting with others. Often what we see is that if you feel anxious already, or if you're experiencing anxiety being in a social setting, you tend to isolate. I would suggest doing the opposite, in fact. I would suggest trying to connect with your support network, trying to reach out to some of your friends. Another coping skill or another method to use for anxiety is to limit your caffeine intake. Oftentimes, the physical symptoms that you can experience, so heavy breathing, heart pounding, sweating, things like that, oftentimes those are enhanced by caffeine. So limiting your caffeine intake can also help manage your anxiety. Relaxation techniques. A really great useful tool that you can do on your own and virtually anywhere is mindfulness meditation that we'll cover in our next video series this month. Other treatment and support options. So like I mentioned earlier, there are specific therapies for anxiety, and we're going to talk a little bit about two that I would recommend. First, we're going to talk about cognitive behavioral therapy. Cognitive behavioral therapy, otherwise known as CBT, is where you look at your cognitions or your thoughts and how they play a part in your behavior. An aspect of CBT is to cover some negative self-talk or negative thoughts and how they play a role in your anxiety. Another therapy specific for anxiety would be exposure therapy, and this would be where you are encouraged to face your fear in a controlled and safe environment. This would also be really great for specific phobias. If you've tried everything, if you've tried therapy, if you've tried other regular self-care techniques and nothing seems to really be helping, it may be time to seek a psychiatric consultation. So typically a psychiatrist will meet with you and get some symptoms and get a history of your behaviors, and they may or may not prescribe a medication in conjunction with other self-care techniques. Okay, so just to recap, we talked today about how anxiety is a real thing. It's not a character weakness, it's not a flaw, but it is manageable. We also introduced some coping skills that are helpful towards managing anxiety, one of which is mindfulness, and we're going to be covering that in our next series. There are also options for further support that are out there. So if you're interested, if you like any of the content that you heard in this presentation, please feel free to visit the links below. We'll have some free resources on our website and others that may be helpful to you. Thanks for listening. Again, this is Arlene with California Youth Services, and have a great day.